The monkeypox outbreak is quietly spread throughout the U.S., and now we're seeing the first cases in Louisiana.
So far in Louisiana, we've only had a few cases and they've all been localized to New Orleans. But as things spread, we don't know what it's going to look like.
Dr. Rachel Kermis is a physician at Baton Rouge General Hospital. She says monkeypox is a virus that's easily spread. The Department of Health already recorded 3 cases here.
So monkeypox is a new virus that we're seeing start showing up here in the United States. We are not seeing it near the same levels that we were with COVID when it first came on board. But we do want to educate the public about it because it is spread through respiratory droplets, and also if we touch something that might have had that virus particle on it, you can get it that way.
The strain we see spreading now first appeared in 2017 to 2019 in areas like Singapore, Nigeria, and the UK. Now the U.S. has documented over 700 cases, but scientists still don't fully understand why the outbreak is happening or where it really came from.
Right now, the widely held belief is that there is more monkeypox circulating in this country than has been formally identified and diagnosed. And there's a few reasons for that. Testing is not as widespread as it perhaps could be. There's a long incubation period on this. Some individuals might misinterpret their lesion for something else, and some individuals just might not go get checked out at a clinic or by a doctor at all.
The symptoms start off flu-like, with congestion, body aches, and fatigue. But soon after, a person will develop sores or lesions on the skin. That's when they become infectious.
Mainly what they look like, it can be little blisters, what we call little vesicles, and they can be in various stages of healing on the body. So if you have any rash that you're like, hey, I don't know what this is, I've never had anything like this before, reach out to your doc, especially if you've been around someone else who had a similar rash. We want to make sure that we kind of evaluate it and see if it is actually monkeypox. They can have a variety of symptoms. They can sometimes have a little bit of discharge from them. They can be painful, especially if we run the risk of getting a secondary bacterial infection on top of it. So if we've kind of opened it up or whatnot and then bacteria gets in, that can make it pretty painful. So it's something we want to just keep an eye on.
The lesions usually clear themselves within 2 to 3 weeks of the initial infection. It's best to isolate during that time, but it's important to remember that monkeypox isn't COVID. It's not likely to be fatal, but precautions should be taken.
So right now, the most important way to keep from getting it is don't touch someone who has a rash right now. Make sure we're washing our hands really good. And then what we can do if we happen to obtain it ourselves is we want to stay at home. And you want to stay at home until the lesions have dried up and scabbed over, and then you're no longer considered infectious.
While healthcare providers are still gathering data, they do know that cases are highest among LGBTQ populations at the moment. But Kermis says this isn't a time to stigmatize.
So I think it's important that when we have a dialogue about monkeypox, that we're not labeling it as something that's unique to just one group of people. It's actually something anyone can get. It's just this happenstance of how it entered into the U.S. and all of that. So I think that's a big message for people to realize.
At this time, the best way to avoid getting sick is to be clean and stay aware of your surroundings.